Hello and welcome to this special episode on the occasion of World Kidney Day. The World Kidney Day is celebrated every year on the 14th of March, and this year's theme for World Kidney Day is Kidney Health for All, Advancing Equitable Access to Care and Optimal Medication Practice. To discuss this and on the occasion of World Kidney Day, with me in the studio is Dr. Shital Lengade. Dr. Shital Lengade has done his MBBS, MD Medicine and DM in Nephrology and has been practicing in Goa for almost the last 20 years. Dr. Shital, welcome to the show.
Thank you. Thank you for having me here.
Yes, sir. So, sir, to start from, what is the role of the kidney in the human body? Let's start with the basics so that the viewers can understand what is normal and what is abnormal.
Right. So, kidneys are two bean-shaped organs which are situated at the back along the spines.
Right.
And the main function of kidney, if I can just say it, is acting as a filter for our body.
Yes.
So, it filters out the waste products which are not required for our body, and it maintains the essential ingredients which are required. The other important functions of kidney are to produce adequate amount of blood which is required for our day-to-day activities, to keep our bones strong and healthy.
Right.
And at the same time to balance the chemicals in the blood. These are the important functions of the kidney.
Right. So basically the kidney acts like a flusher to flush out toxins and also helps us to get what are the vital important components required for our day-to-day activities.
Right.
So by and large, what are the various diseases that affect the kidney?
So when we say kidney disease, there are two important types which we have to know. One is an acute kidney problem, or what we call it as acute kidney disease, where because of certain illness the kidneys temporarily shut down.
Right.
And once the patient receives appropriate treatment and care, the kidneys revive back. They come back to normal function. So this is what we call it as an acute kidney disease. The reasons most commonly which are seen in Goa particular are painkiller medications, medication-induced kidney disease.
More of an abuse.
More of an abuse,
taking
yes.
pain medicines.
Yes. Then diseases like malaria, leptospirosis,
Right.
severe diarrhea.
Yeah.
These are the common illnesses which can make your kidneys, trigger into failure.
Yeah.
But the good part is if the patient is receiving treatment on time, then those kidneys will revive back. So that is what we call it as acute.
Right.
The other type of kidney disease what we commonly see is chronic kidney disease. The term says that chronic means it's been there for a long time and it is irreversible. So chronic kidney disease is what we see most often. The most common reason for chronic kidney disease is diabetes, hypertension, recurrent kidney stone formation, a condition called as chronic glomerulonephritis, where there is ongoing inflammation inside your kidneys and that can lead to kidney failure. And in some percentage of patients we see genetic kidney diseases, like for example polycystic kidney disease is a very common problem which we see in Goa, and that can eventually lead to kidney failure.
Right. So doctor, you've already highlighted the causes of acute as well as chronic kidney diseases. Could you elaborate more on these causes?
Yeah. So the most common causes of chronic kidney disease what we see are diabetes mellitus, which is the most common cause. Almost 40% of patients with chronic kidney disease are because of diabetes.
Right.
And remember that diabetes causing chronic kidney disease doesn't happen overnight. It takes years of diabetes to actually cause kidney damage. Unfortunately, in the initial stages, most of the patients are not aware that they have any kidney disease. They never test, unfortunately, for kidney diseases. It is only the blood sugars which are checked, but that doesn't reflect on the kidney function. So a diabetic patient who has diabetes for more than 5 years should be concerned about kidney function, and he should be testing regularly for kidney disease.
Right.
The second most common cause what we see is blood pressure. If you have hypertension which is there for a pretty long time, then your risk of kidney disease is high. Patients who have frequent kidney stone formation are always at risk for chronic kidney disease. Then in certain parts of our state, especially down south in Konkani and surrounding areas, we have chronic kidney disease which is still of undetermined etiology. We still don't know what
could be the
what are the reasons, but it may be genetic factors because most of the diseases are seen in very particular communities.
Right.
It could be an environmental factor which is there, which we are still not aware about. So certain reasons which we are still not aware, or maybe some toxins which are there.
Right.
So these are the most common reasons, and as I said, certain patients have genetic predisposition for chronic kidney disease. So polycystic kidney disease, or what we call it as ADPKD, is one of the most common reason for people to have chronic kidney disease, and we do see it quite often in our state.
Right. So doctor, what could be the signs and symptoms of acute as well as chronic kidney disease?
When we say acute kidney disease, the kidney damage has happened in a very short period of time. It happens in hours to days. There is no time for the kidney or the body to adapt to that change. So patients usually come very sick. Most of them will have symptoms like decreased urine output, or
which is a very common symptom.
Yeah, decreased urine output, or swelling over the legs, or swelling over the face, especially around the eyes. And most of the patients will be sick in the form of loss of appetite, nausea, vomiting, or breathing discomfort. So these are the symptoms which an acute kidney disease patient will have. Now on the other hand, chronic kidney disease takes years to develop. The body gradually is adapting to the changes in kidney function. So the symptoms don't come in the initial phase. Most of the patients with chronic kidney disease are absolutely fine till the kidney function becomes too poor, or the kidney disease becomes too advanced in the stage, and they come very late stage. So almost 80% of the kidney function is lost without the patient, knowing it. And by the time patients start developing symptoms, for example, again swelling over the ankles, or change in the urine pattern, or loss of appetite, nausea, vomiting, by then the kidney disease is already in stage 4 or an advanced stage, and then they come to us where they actually require either medications, or some of them have to go on dialysis straight away. So remember that chronic kidney disease in most of the initial stages is asymptomatic. You absolutely are fine and healthy, and that is the reason why it is very essential that patients who are at risk for chronic kidney disease have to be tested periodically. At least once in a year you have to check their kidney function, because the kidney disease can progress without your knowledge.
It's like a silent killer.
Yeah, it can be a silent killer if you don't
address
look at it. Yes.
So to my understanding, if I would like to put your explanation in a few words, acute kidney disease usually is around a very acute disease that the patient suffers from, like some disease provokes the kidney to go into shutdown, whereas a chronic kidney disease develops gradually because of some lifestyle diseases which the patient already has.
Yes.
Right. So doctor, what could be the signs and symptoms of these things?
So as I said, the typical signs or symptoms of kidney disease are swelling around the ankles, when you get up in the morning, puffiness around the eyes, or swelling over the face, change in urine pattern. What we say pattern is you need to get up in the night more frequently to pass urine than otherwise. So if you notice any change in the urine pattern, then that could be because of kidney disease. Change in urine color itself. So sometimes patients can notice that the urine, there is a lot of froth in the urine. The urine is foamy. That is a very important sign that your kidneys are getting damaged, and they are leaking proteins. So these are the usual symptoms. Other than that, yes, patients can have symptoms like loss of appetite, nausea, vomiting, feeling lethargic, unable to concentrate, having a dry, itchy skin. Sometimes in late stages you can have patients coming with breathlessness, unable to sleep properly. So these are all these symptoms which come late in the process of kidney disease. As I said, in the initial stages of kidney disease, especially chronic kidney disease, patients are absolutely asymptomatic, and they are absolutely fine.
Fine, right. So doctor, a little while ago you spoke something about stage 4 and stage 5. So what is the staging criteria in chronic kidney disease?
Yeah. So when we say chronic kidney disease, it doesn't mean kidney failure. Chronic kidney disease can be staged based on something called as GFR, and we tell every patient who comes that you should know what is your GFR number. So GFR in simple terms basically tells you what is the filtration function or filtration rate of the kidney per minute, and it is a number. So the normal GFR is above 90 ml.
Right.
So when your kidneys are healthy, you are supposed to be having that GFR of 90. Now as your kidney disease starts and as it starts progressing, this GFR number will fall from 90 to 60 to 30 and below 15.
Right.
So based on what is your GFR, at what number you are classified as either stage 1, stage 2 or stage 5. So when we say kidney failure, it is stage 5, that is the GFR below 15.
Okay, and that is a point of no return.
Yeah, and that is a point where most of the patients are sick, and most of the patients will require treatment like dialysis or transplant.
Right.
In the earlier stages, that is when the GFR is above 15, you can be well managed by medications, by diet and various precautions.
Yeah, right. So doctor, how do you diagnose kidney diseases, or what are the different tests that is done to identify kidney disease in a patient?
So as I said, kidney disease in the initial stages are asymptomatic, but you can definitely diagnose it quite early. And two simple tests which are available in most of the laboratories across Goa. One is doing a urine examination, testing for a protein in the urine, something called as urine albumin creatinine ratio.
Right.
And second is serum creatinine, which basically can tell you what is your GFR.
Right.
So a urine test to identify that there is a disease in the kidney, and a blood test to know what is your kidney function.
Levels,
yes.
Yeah.
So these are two simple tests. These are available in any laboratory all across Goa. These are not very expensive, very cheap.
Like the simple blood tests
yes.
that are done.
But these tests, if you do it on a regular basis, can tell you whether your kidneys are normal or diseased.
Or diseased.
And as I said, for diabetics, for people with hypertension, for people with stone disease, for someone who has got a family member with kidney disease, these two tests, if done, if they are done on a regular basis, you can definitely diagnose kidney disease very early. Now there are additional tests which we ask for, like for example, we do a blood test to check for your hemoglobin level.
Right.
We do your ultrasound to look at what is the kidney structure and whether there are stones or there are cysts in the kidney. So these are ancillary tests which can be done for getting further information. But as I said, basic test is a urine examination and a blood test for creatinine. Right. These two are very basic and essential tests for diagnosis of any kidney disease.
Right. So doctor, now we would move on to the different treatment modalities in acute kidney disease as well as in chronic kidney disease.
Yeah. So acute kidney disease, as I said, is a kidney condition where the damage has happened very abruptly because of certain specific reason, and the treatment in that is basically treating the cause for acute kidney disease. Like for example, if you have malaria or leptospirosis or dengue, and if you are treated for that and you recover, the kidney function will recover. If you have taken a painkiller medication and if you stop it on time, the kidney function will definitely recover. So that is for acute kidney disease. Now for chronic kidney disease, as I said, based on the GFR, you can decide, or you can be treated based on the GFR. In the earlier stages of kidney disease, when the GFR is above 15 or 20, the patient is managed by controlling his risk factors. Someone who has got diabetes, we make sure that the diabetes is well controlled. If you have hypertension, we try to get the blood pressure control proper, keep it below 130/80. If you have been taking any medications which are causing kidney damage, we obviously try to identify and stop that. If you have got kidney stones or any other risk factors, we try to take that out. So we try to identify and control the risk factors first, which helps to preserve the kidney function. But if the kidney disease progresses further, and if you land up into stage 5 kidney disease where the GFR is below 15, then there are two options, dialysis or transplant. So these are two options which are there for patients with kidney failure.
Right.
Most of the patients who are in stage 5 kidney disease and who are having symptoms or who are sick because of kidney failure will start on dialysis first. Dialysis will definitely make them stable, make them get better, make them come back to normal health. And as I said, kidney transplant is an option which is definitely way better than any form of treatment.
Yeah.
So we counsel the patients about these two treatment options. Sometimes if the patient is healthier, is not sick, and has got a family member who can be willing to give him a kidney, then we can also consider doing transplant before we start dialysis. So something called as preemptive kidney transplant is a much better option against all the available options. So especially for young children where dialysis can be a technical issue doing it, and children don't tolerate dialysis as well as adults. In children, we definitely consider kidney transplant before starting dialysis. So that is a better option for them. But on the other hand, for all other people of all across ages, dialysis and kidney transplant are two options which can be considered.
Right. So doctor, as you highlighted just now about kidney transplant being a treatment modality for patients suffering from CKD. So what exactly is kidney transplant all about, and do we have options of kidney transplant in Goa?
Yeah. So kidney transplantation in simple terms is basically taking the kidney from a donor and putting it in the patient who has got kidney failure. So that's the simplistic way. Now kidney transplantation is the best treatment option for any patient who has got kidney failure.
Right.
Obviously to undergo the transplant surgery, you have to have certain amount of health and fitness.
Right.
So patients with kidney failure who have got a severe heart disease, who have got cancer, who have got severe infections, or who have got severe liver or lung disease obviously cannot undergo transplant because they are not medically fit. But on the other hand, most of the patients with kidney failure are fit enough to undergo kidney transplant surgery. The kidney transplant surgery is either a living donor transplant surgery where the family member has to be a living kidney donor, or the transplant surgery is a deceased donor or a cadaver transplant surgery.
Right.
Now living transplant surgery has got advantages. The kidney transplant surgery can be done as per a timed schedule. The kidney from a living donor is much healthier and it starts working immediately after you do a transplant.
Right.
The donor is usually a related family member who is between the age group of 20 years to 70 years and should not be having any significant medical diseases on his own. But I want to tell you that becoming a kidney donor or giving a kidney, one of your kidney to your family member is a very safe surgery. It will definitely not put you in any disadvantage as far as your health is concerned. It is not going to cause any health hazards on you.
Right.
Your lifespan is not going to change. You are going to live the same life even if you choose not to become a donor. But it is going to give a sort of gift of life to your loved one. So the emotions, the attachment, the happiness what you get from becoming a kidney donor is worth all the risk, all the sacrifice what you are going through. So I would definitely encourage that if you have any member in your family who has kidney failure and is advised to undergo transplant, then you should definitely consider yourself to become a kidney donor. It's the best gift of life which you can give. Now for people who don't have family members willing to become a kidney donor or are unsuitable, then they can definitely register themselves in the kidney transplant wait list. So according to the blood group, there is a wait list which is maintained by the SOTO, the organization which is there in Goa Medical College, and it maintains the wait list based on your blood group, based on how many years you have been on dialysis and what are the problems. Yes. So and whenever there is a call for kidney, or when there is a
kidney available,
when the brain dead patient's family opt to donate the organs, then based on your waiting list number, you are called in the hospital and you can undergo transplant. So
based on your blood group match and all of that.
Yes.
Right. So doctor, we've already spoken about the treatment of kidney diseases. What would you like to highlight on how to prevent kidney diseases?
So every year on second Thursday of March, we have World Kidney Day, which is being celebrated now for almost more than 15 years all across the globe. And the main theme of World Kidney Day is to highlight the importance of kidneys as an organ for our health. And how to take care of them.
Right.
So taking care of kidneys, you don't require too much efforts to put into. So
doesn't require rocket science.
Yes. So simple things which I would advocate for keeping your kidneys healthy is first is be healthy and stay active. If you are active in your life, if you are overall healthy, then your kidneys are going to stay healthy. Second is don't put on weight. I mean, if your weight control is good, if you are not overweight, obese, you are unlikely to develop any kidney disease. If you have diabetes, ensure that the diabetes is well controlled. Right. Ensure that your HbA1c is kept below the target, which is less than 7% for most of the patients.
Right.
If you have blood pressure, then blood pressure should be well controlled. A well controlled blood pressure is usually below 130/80, at which the kidneys are optimally functioning. If you are in the habit of taking over-the-counter painkillers, then that should be strictly stopped. So don't take painkiller medications unless your doctor advises you. If you are smoking, then stop smoking, because smoking is one of the most important risk factor for kidney disease. And if you have family history of chronic kidney disease, if you have a family member affected with kidney disease, if you are above the age of 65 or 70 years, then do get yourself tested for kidney function. At least once in a year, you should check your urine, you should check your blood for creatinine. And last but not the least, stay well hydrated. In a place like Goa, we tend to sweat a lot, so we should be adequately hydrated, which is basically having at least 8 to 10 glasses of water every day. So make it a habit. Make sure that you have that 10 glasses of water every day, and your kidneys are just going to be fine.
Right.
So these are basic, simple steps which each one of us can adapt. And if we do that, then we will find that our kidneys are going to support us till 100 years.
Right.
Yeah.
Dr. Shital, thank you so much for taking time out and spending time with us and elaborately discussing kidney, its functions and the diseases and the prevention. I'm sure our viewers will surely learn from this episode and try and maintain healthy kidneys in their life. Thank you so much for watching this episode. Take care. Keep watching Prudent.